Okay. Who is here because they've had knee pain in the past? And who is here because they've never had knee pain and they want it to stay that way? Very nice. More than I expected. All right. I will do a brief introduction of myself and Onward Physical Therapy. So this is Dr. Emma and myself. We are Onward Physical Therapy. That's it. You call, you're going to talk to one of us. There's no support staff. There's no techs. There's no PTAs. It's just one-on-one physical therapy for an hour with us. My background specifically is in orthopedics and mostly barbell fitness athletes. So I'm certified in management of the fitness athlete and management in orthopedics. The difference between Emma and I lies solely in personality preference, and Emma does a lot more with pelvic floor. Okay, so that's kind of her bread and butter, is more in the pelvic floor realm. My bread and butter is more in strength and conditioning. So I used to be the head coach and write all the group fitness programming on it for a gym on the east side. I did that for several years and then decided to jump head on into out-of-network one-on-one PT practice. I was doing it out of my car, going to people and hauling everything, and then, Emma and I met coincidentally getting our CrossFit level 1 for coaching, and it's just kind of been us working together ever since to bring what we believe the best care model in physical therapy to Tucson. So, enough about us. I love this. This is kind of what Onward Physical Therapy is about. Why we load. Why do we do the thing? Not because we want to move the most weight in here, but because we load for the life we want to have, for what we do out of here, right? Everyone wants a silver bullet for long-term injury prevention, long-term wellness. It exists right in these 4 walls. Nothing replaces exercise. I'm a big believer that the body is a machine. People fail to take care of the machine, whether it's in here, right, expressing full range of motion, continuing to achieve loading goals. The higher I push my capacity in here, the greater my capacity is out there. I don't deadlift 400 pounds for ego. I deadlift 400 pounds because when I have to do 2 hours of yard work bending over and shoveling with my parents, I've got the capacity to do that, right? I'm far less likely to be injured outside of here. That's why pushing in here is so important. That's why when pain presents, it's important to stay in here, okay? Not to leave here. The gym doesn't get people injured, okay? There are no bad exercises. All right. Here's our plan for the day. We're going to talk briefly about why injuries happen. We're going to talk about the biggest myths around knees, okay? And then we're going to go over mobility basics and some strength basics, okay? Show you those sorts of things. Because really the goal of the day is for me to empower you with kind of the things that I look at first when people come to see me and they say my knee hurts, okay? So I want you to be able to kind of tick those boxes for yourself and manage a little bit better on your own. Why do injuries occur? I put these in order of what I think is most important or most common. Volume. Too much, too soon, too fast is a recipe for injury with anything, not just specifically the knee, but in general. This is what I see happen with a lot of people. Okay, I'm going to get healthy. I'm going to start exercising. I'm going to go every day. I'm not going to miss any days, right? And there's training at a volume that they can't recover from. Training volume is dictated by recovery, right? Those things have to go together. So that's great. You want to exercise 5 days a week, but if you're doing that, did you up your hydration? Are you eating more? Are you prioritizing sleep, which is the greatest performance-enhancing drug on the planet that nobody uses? Okay? Those sorts of things. It's not about supplements. It's about those big buckets. You are an ecosystem, okay? Volume is a variable coming in for training. Your hydration, your sleep, your nutrition, your stress management are the other buckets, and they all have to balance out at the end of the day for you to have a training volume that you can recover from and stay healthy, okay? Right? Next is the lack of mobility. And for those of you who don't know, there was just an in-service here not too long ago with another PT for the coaches. And he and I agree on a ton of things. But what I will say that I agree with him the most around the knee is people don't know they're missing knee extension. The ability of the knee to straighten, and not just straighten, but slightly hyperextend. You don't have knee extension, you can fast track yourself to a knee replacement. It is, by and large, the biggest variable that I look at when somebody comes in with knee pain. Can you fully extend the knee? Can I put my whole body weight on top of it and push down? That needs to be there, and it needs to be pain-free, okay? We always are worried about bending, right? Because it limits squat depth, right? It is important, but if you're missing knee extension, if you find that today you don't have knee extension, just pick one thing and do that really well for a long time and your knees will get better, okay? So we've got training volume up top, too much, too soon, too fast, or not recovering from our training volume. Okay. Lack of mobility, I can't straighten it all the way, I can't bend it all the way. We're gonna go over how I look at how you should be able to do those things. And then lack of strength is the next one. And I don't mean just here in that quad. Or what do we most commonly do when we go to PT for knee pain? Your glutes are weak. Are they? I don't know. What about the muscle that's right on the front? The quad, but the whole system is important. We're gonna talk about like the health of your squat at the end, right? But the whole ecosystem. You can't just be like, no, I've never seen somebody come in and they're like, I have knee pain and all I find is that their quad is weak or their glutes are weak. There's a system problem, right? It might be a movement problem, like a technique fault, but honestly, if I can't squat somebody, I deadlift them. I deadlift them till they max it out and then they're ready to squat. I don't care. You're getting tissue health by deadlifting, by picking other movement patterns. And then lastly, our technique faults. Sure. If you don't master good squat mechanics, or you don't master good lunge mechanics, or you don't master, step up mechanics, and every time you step up, because your goal is just to do a step up, it looks like that, and I'm pressing that knee to the inside, there's gonna be pressure somewhere. It's just like training volume. Too much, too soon, too fast on one structure of the body. I look at technique faults when people come and see me, but honestly, it's not the first thing I look at. How much do you train? How much protein do you eat? How much do you sleep? Do you feel like you're rested in the morning? If you can't answer those questions for me, I don't care about anything else. Because anything I give you specific is not going to be nearly as effective if we're not talking about the whole system. If you don't have a healthy environment to heal in, meaning inside your body, then doing quad sets and doing clamshells, you can do them till the cows come home. But if you've got inflammation globally, it's not gonna matter. You'll always be shy of your 100%. Okay? Questions on any of these things so far? You guys are just letting me get on my soapbox. All right, let's go over some myths. Who thinks deep squats are bad for your knees? I know. Good. Tell you why. Okay. Deep squats do not contribute to increased risk of injury to passive tissues, meaning the meniscus, which is what most people are worried about, cartilage, right? What it does is presents an effective training exercise for protection against injury and strength of the lower extremity. It increases loading and positive anabolic, meaning growth of tissues, stimulation to tissues, right? That are protective against what we're most concerned about, which are degenerative changes. The body's pretty straightforward. Use it or lose it. What they have found is in individuals who utilize deep squats in training, they have 14% more cartilage than those who don't. Crazy. Now, ankle and hip mobility required. Full knee range of motion required. That being said, I'll just elevate your heels. Just optimize it. Nobody's making their money competing in here, correct? I'm just asking, right? Nobody makes their living competing. Optimize your squat pattern with the tools that are available to you. Sure, maybe we want to be able to squat with our feet flat. Sure, it's helpful. But within this environment, when I'm trying to build capacity for my life, optimize how the movement feels. Elevate the heels, counterbalance. Don't back squat. Use a goblet squat. Go ahead.
Yeah, pardon the expression, but when we say deep, are we talking parallel or that's
A to G. Okay. Parallel, so there's a problem with parallel squats. There is one problem with parallel squats. When you reverse your parallel squat from here, you are changing the pressure on the kneecap when the compression behind the kneecap is the greatest. So biomechanically, if we look at forces in the knee, when I am about 90 to 100 degrees of knee bend, the pressure on my kneecap is the greatest. So when you reverse through there and you're changing from eccentric load to concentric load, you are doing it where you are having the greatest pressure on the backside of the kneecap. So most people are doing that right where they have majority of their pain. Yeah, full range of motion. I mean, if I can bend my knee this far, I want to be able to squat down that far. Tissue health, and use it, okay? I love this one. I adore this conversation because what we have done in the fitness and the health industry, particularly PTs, which they should all be taken out back and beaten with sticks for this. I want you to squat, Doris, but I want you to keep your knees behind your toes. I would love to see somebody demonstrate a full squat like that. What does that actually look like? A deadlift, yes. Deadlifts are great, but all you're gonna develop when you do that is glute hamstring strength. You're never gonna get the quad strength you want, okay? So no, we have to let the knees go over your toes, and I'm gonna tell you why this is important. In order to optimize forces at all involved joints, it is advantageous to permit the knees to move slightly past the toes when in a parallel squat position. Now, how many people have back pain? How many people have hip pain? Right, okay. If I block your knees when you squat, and I say don't let your knees go past your toes, awesome. 22% less force went into your knees, which will make your knees feel better. The other side of that coin, though, is that I increase force on your spine and your hips by 1,000%. 1,000% of that force goes to the spine and the hips. So here's what they found when they looked at this again. The evasive movement creates greater anterior shear force on the intervertebral discs, which everyone is worried about all of the time. I hear it all day. I have a disc in my back. Yes, you have many. Right? And causes tensile force on the intervertebral ligaments. Meaning, if I block it and I don't let my knees go past my toes, because I took a fitness class in the 90s and I went to PT and that's what they all told me, is put your butt back. What the spine basically is doing, if you can picture like one segment, the other segment, is the spine is working so hard to not do this. Okay? So the more I accentuate that, because I'm really trying to get to a full parallel squat, the more I end up here. And the bar or the weight is so far away from my spine that that's where that force comes from. Okay? So yes, keeping the knees back reduces force on the knees 22%. And in some cases, we need to do that if you're having knee pain. We don't want the knees necessarily to go forward. We want to keep squatting. But eventually, we have to work our way back to knees past toes. Otherwise, we get 1,000% force on the hips and the spine. Okay? Oh, I love the bottom one. The recommendation is based on misinterpretation of existing data and should be removed. Not even like discouraged. Removed from literature. It's like it's so outdated and antiquated. What we have essentially done is people don't know how to load their quads. You can't get quad strength if your knees are always behind your toes, okay? I will say that the majority of people I see come in with knee pain when I see them squat. I say, what are you thinking about when you squat? And they say hips back. I go, why? Well, because someone told me that. Okay. So that's really where I spend a lot of squat retraining, right? Is trying to get a more balanced squat, right? This is also not great. I'm just jamming my knees totally forward, staying upright, not using my hips at all. Okay, so we have to find balance in squats. That's kind of the technique piece. Everyone's squat looks different. I'm not married to like a specific squat technique. I want it to be balanced and feel good on your body, right? That's usually the issue is I was told to squat this way and it doesn't feel great, but I don't know the alternative, okay? Squats vary based on, Kirill did this to me the other day. It's based on arm, torso, and leg length. Kirill can kick the middle of her hand with her leg just by standing there. I know. Show us. Yeah, come up here and do it. So your body, like anthropometrics, dictate how your squat looks, right? I have a much more hip dominant squat, so go ahead. Yeah, that must be nice. That must be nice. I'm like, wow. So I'm far more leaned forward than she would be in a squat, okay? So we just have to get comfortable with the idea that everybody's squat looks a little different. How much you turn the toes out, what your hips can tolerate, your injury history. But the importance is that we can squat, develop a balanced squat, okay? These are my knee health basics. People come to see me and they say, why did this happen to me? I say, that's a good question, right? I start down here with the knee. So the unfortunate truth about the knee is without injury, like let's say you don't step off a ladder wrong or twist your knee or have an incident, right? You just develop kind of general knee pain. They start to ache. The thing with the knee is that it is a whole ecosystem problem, meaning if I don't meet exercise guidelines, okay? If I'm not taking care of the machine, right? You get into this inflammatory state, and that's where cartilage and sensitivity start to kind of degrade a little bit, right? So the best thing you can do for your knee health, for those of you concerned about osteoarthritis, is meet your exercise guidelines. It will move the needle the most. And these are the guidelines: 150 to 300 minutes of moderate exercise, or 75 to 150 minutes of vigorous exercise. I don't know about you, but I like the idea of 75 to 150 minutes better than 300. In a week. So here's my recommendation on that. Go to Block Fitness more. Okay? There's a reason that in your programs you see kind of progressive overload, right? That's the whole point, is to make things harder, get more capacity. Exercise should move from I develop moderate tolerance to now I'm pushing myself into a little more vigorous, right? So I find that most people are underloaded. Okay? So I encourage you to be a little more aggressive, even if you have to modify a little bit. Okay? So that's the big one with the knee. General well-being dictates knee health more than anything, particularly outside of having it traumatic or an injury that you can speak of. A lot of people come and see me and they're like, I don't know, it just started hurting. I'm like, okay. First thing I ask them is, how much do you exercise? How much sleep are you getting? How much protein are you eating? Right? Are we managing those sorts of things really well? Because if the ecosystem stinks, the body will start to break down. Period. Now, full range of motion in an unloaded position. I say that because you may have pain with squatting, right? But can the knee itself express full range of motion? So full extension and full bend, okay? So extension is straightening and flexion is bending. We're gonna screen those sorts of things, okay? So we're gonna screen them now as a group, okay? You're gonna kind of just gather whether it hurts, okay? If it's limited or you're not sure it's limited, then you'll let me know, okay? But the easiest way for us to check is we're gonna grab some foam rollers. We'll grab the foam rollers out. I'm gonna demo first, so nobody move. Otherwise, it's like herding cats, okay? Okay. Most important thing for your knee health is your ability to extend. You have to have full extension for walking. That's why. If you're missing 1 degree of knee extension, I care. That's unacceptable to me. You have to have 0 or a little extra, particularly if you're stepping up on anything. Okay, it gives you the little wiggle room. I know. Extension impacts flexion. So you've got to have that, okay? All right. I have a lot, so don't be concerned. I have a lot, and it's not necessarily the greatest either, but you have to float the heel on something so that nothing is touching the calf. Okay, so if the calf is touching, and you're like, yeah, it's straight. The calf is taking up some, so you're not getting a true measurement. Okay, this is how I check it in the clinic. Float it. Now, I'm gonna look right here, and I'm going to try to squeeze that as hard as I can, pushing down. You see all that extra? I know. I wish I had that mobility in other places, but I don't. It's only right here, right? So it's the ability to squeeze and hyperextend, okay? Super important. that you can do this, okay? Flexion, this is where I start. You need to be able to touch heel to butt. If that's easy, then I encourage you, can I sit all the way back here? Hips to heels. This is where I will take people once they're ready for it, right? Okay? So we're gonna screen those sorts of things, okay? We'll take 5 minutes. There's foam rollers on the wall. You can use benches. You can sit on the floor. I don't care what you do. I'm going to be floating around. I will try to get to all of you if you have questions, right? But here we go. We'll take 5 minutes. So when that clock gets to 11:38, we're going to move on to how we're going to work on these things, okay? Ready, set, break. I know, smart. Go right for it.
We're gonna fight over those. Okay.
Squeeze and press down. Oh, pretty good. Now, if I come in here, go ahead and relax.
Mm-hmm.
Any pain as I push you in there?
Not on that one.
Okay. What you're looking for is differences, right? Pain is one part of it. But if we've got a difference side to side, then we're going to work the exercise I will show you, you will do on your less than mobile side.
Quick question for you.
Quick answer for
I
you.
have an artificial knee.
Yeah.
4 years old.
Sweet.
And I still work out at the gym. 4 days a
amazing.
week, everything I try. But on the knees, I use the sled, the leg press a lot.
Yeah.
I use the bike a lot.
Mm-hmm.
On this, you recommend I still do squats with this knee?
Oh, yeah.
So it makes no difference.
I want to challenge the crap out of that,
Okay.
that
So
implant.
keep working on.
Oh, totally.
Okay.
Yeah.
Okay.
Do one leg and try to get your heel all the way to your butt.
Yeah.
Was it enlightening? Yeah. It is kind of enlightening. It's pretty shocking how much your range of motion. So if you're missing range of motion and you come to see me, it's not that I don't care about anything else. It's just I know that what has happened is, the way I look at range of motion loss is if I have this big of a box of movement, right, where I can distribute force throughout the whole knee joint and share the load. If I'm missing range of motion, my box went from this size to this size, okay? So now something is going to be biased towards load. And the reason that extension is so important is it's like what we call the resting state of the joint. Meaning when you're in full extension and you have access to that, the joint is congruent in all directions, meaning nothing's getting pressure on it. Okay, if it's slightly bent, like if you're missing just a couple of degrees, right? That means that either the inside of the joint or the outside of the joint is sitting with a little more pressure on it, kind of at all times. And then that is just extrapolated when we're talking about the weight bearing with walking and stepping and running, okay? Do we have like a hip thrust pad or like a hip thrust pad? Can I borrow one? Are you worried about hip thrusts?
Yeah,
Oh no, like a barbell pad. Sorry.
like these?
Yes, these. No, that one.
You want the round one?
That one. Thank you. You're like, speak English. All right. So I'm going to demo what you do about missing extension and missing flexion. Okay? That's what's going to be in your emails, how to fix it. Because I would start you there anyway, and you're all competent and independent human beings, in theory. Okay? As I'm going to make a giant assumption. What I'm going to do is I'm going to use the rack. Okay? So I'm going to have you guys just kind of turn around, and you can see me through the center here. I won't be there very long, so we don't need to like pivot chairs or anything. What you doing? Getting a chair?
Getting a chair.
Okay. All right. So I told you extension was the most important. So So we're gonna start there. This is a 2-band setup. 1 band there. Take my foot, I put it in. Bring this up and over. Float the foam roller. And now I'm gonna scoot out. So I'm getting this nice little traction through my knee here, okay? Feels good. I take the other band and I loop it around here. And then I pull. I have more on this side than the other side. So if the other side freaked you out, this one will too. But I'm pulling into a bit of a calf stretch. While this is tractioning the joint, I'm pulling into a calf stretch and just not allowing my knee to bend. Because as I pull into a calf stretch, if I'm missing extension, the joint's gonna look for relief and it'll pop forward. So I'm just using this hand like a little weight. Anybody who's had there's a couple of post-op knees in here. This is far more comfortable than, hi, I'm gonna just have you sit here with your leg elevated and propped for 5 minutes. Where's the knee replacements? That's like what they have you do, right? They're like, okay, we're just gonna float. And it is honestly just post-op knee, it's miserable. But this gives you that traction. And then I'm pulling through here. And then as you do that, you can start to work that kind of quad squeeze and press down. Because really it's one thing to open it, it's another to be able to actually do that and set that quad all the way through, okay? If you don't have this, it's not gonna matter. You have to have this, okay? If I leave you with one thing for your knee health, this, get it straight. And give yourself a little window of hyperextension. The knee should have a few degrees of hyperextension. If anybody's told you 0 is enough, they lied. You need to have a couple of degrees of hyperextension, okay? So, yeah.
Anybody work out Coach Juliet? If you work out at OB? Have you ever seen her workout before she does her squats? Because she had knee surgery like 6 months ago. She puts her foot up on a foam roller, just like Abby does, and takes a 25-pound plate and rests it on top of her leg because she's trying to get back those last 2 degrees so that she can actually squat effectively. So it's what she's doing herself for her own rehab before she actually does the same thing.
Totally. 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 If you lose extension, I think the stat is you're like 4 times more likely to have knee pain or knee surgery. It's like 4 times. So we're gonna do a little like quad lift-off exercise at the end, but being able to fully extend is one thing, and then being able to do the quad part. So I usually will put those 2 together, so we'll kind of go over that, okay? Now bending, is far less important in my world, but it is important to have full range of motion. So if you're limited in extension, start there and only do that for a long time, like a month. Then move to working on bending. Bending is a little more simple to work on. You're gonna take, this is great, we have the iron bowl for like a hip pad, a rolled up bath towel at home, just take one you don't like and then duct tape it and just make it your roll. Yeah, and just make it your roll and just keep it that way. Honestly, I think everyone should have one. I do this before I squat just because it feels really good on my knee. So the beginner version is to start here. You wedge it all the way up in there, and then I'm gonna come around and grab my shin, and I lean back, and now I'm trying to kind of bend into that. Okay? And it's just this really nice kind of like, somebody said to me the other day, they're like, it feels like the joint is breathing. I'm like, perfect, excellent. Now, if you already have full bend and it feels good, this won't be enough for you. You're just gonna take it and then sit all the way back and just kind of hang out here, and then I'll walk that knee up towards the ceiling. And it's just this kind of big, like, gapping stretch on that knee, okay? So these are your kind of 2 knee joint health, right? And the way I think about it is I'm just kind of trying to take my knee through full pain-free range of motion with a little overpressure to kind of almost wring it out like a towel, right? Which is gonna stimulate a little bit of blood flow through there. The way your body gets stuff around is it squishes, right? That's why things don't feel good in the morning, because nothing has been squishing. You've just been laying there, right? And so there's this chemical soup that's like, ugh, right? That's why I take a few steps or I walk around for a few minutes and I get warm and everything feels better. That's a blood flow response. Or mechanically, we're like squishing the joints and the tissue, right? And so you get a better blood flow response. So you do want to take joints through full range of motion and then overpress them. That's full tissue health, right? So it's one thing to be able to bend your knee fully, but what you want to be able to do is, when I check it in clinic, I like lay my whole body weight on someone. If you can't tolerate that, we're not there all the way, okay? That's how I make sure you're north of 100%. That's the 110%, okay? Questions on these 2? Cool. They'll be in the email. Okay? Now, it says up there, quad strength. I love doing quad strength. There's nothing wrong with it. But how you do it, if we're talking about knee health, is super important. Okay? So one of my favorite things to give somebody is I will have them sit on a bench or a box. This will be fine here, okay? And chairs at home work really well for this. We have kind of like taken leg extensions out of people's lives because we thought they were bad, but now we know we've left people with quad deficits, particularly if they've had knee pain or knee surgery. So I'm not just like, we're not just gonna do this, right? What you do is it's 2 seconds on the way up. All I'm picturing is right here. Full extension, lift 1 to 2 inches. The knee is not allowed to bend. You can see I'm shaking. Coming back down, knee still isn't bent. 2 seconds down. 2 seconds up. 2 second hold. 2 seconds down. And I put a kettlebell on your foot. I know. I know. Right? So it's quad isolation. So yes, part of rehab and getting healthy is big movement patterns, compound movements, right? Squats. The other side of the coin that I feel like as a PT gets lost is the bodybuilding element, right? Pain impacts muscle function. I have to turn your muscle function all the way back up. And I can't always do that with a squat pattern because you'll have modified the way you move around pain to offload something. So part of it is re-engaging the idea that I can feel my quad at 100%. I actually can give myself a quad cramp doing it. Because all I'm thinking about is, when I have people do this, it's like, you can't even have the TV on. Your phone's somewhere else. Your eyes are right here. We're gonna Arnold Schwarzenegger it. You are only thinking about this. I am only thinking about my quad, and I'm trying to cramp that thing. Like, I am squeezing it so hard to get a cramp, and I'm overloading that function, okay? The other one that's up there is Spanish squats, because I think they're super important. They offload the knee joint, right? I'm not gonna demo them, they do them really well here. But if you have knee pain and you're like, I don't like Spanish squats, I'm sorry, you need to do them, right? Because they keep tension on the quad and they force you to work through supported range of motion. So that's one of the other things that I almost always give people. Questions on either of these? Or
Everyone is now getting Spanish squats in their plan. I'm messaging all of your coaches.
Go ahead. So I like to set it up with a band behind each knee. I don't like to step into it all the way. And this may not even be enough for, well, you walked all the way back. Scoot forward just actually a little bit for me. So a couple of things here.
That's how you know you're doing it right.
Straighten your knees back all the way. There you go. A couple of things. Look at this lean. Okay? If you're not leaning in a Spanish squat, you're not doing it right. Because now what I'm going to ask him to do is bend his knees and his hips, but his torso has to stay upright. And shins are going to stay vertical. So it's here. We're going to stay really upright. And then we're going to get up and come back to that lean by extending the knee fully. What it does is it offloads the knee joint because you can stay a little more vertical, but all of that tension is here. And then it's pushing up and back and getting back to full extension. Must do this very well. If you don't feel this exercise in your quads, you're not doing it right. You're getting around it. Most people will like fold in half. Most people will kind of do this. That's not going to do the exercise. That's not doing what you want out of it, right? So it's there, we're leaned. The band is essentially holding him upright at the top, right? And then coming up and back. People make the mistake at the top for sure. They're kind of like here. If you feel like you're gonna if you feel like you're gonna kiss this, you need to like find that leg extension. I can't do it when I'm not banded, but yeah. So Spanish squat. Oftentimes I find that will make squatting pain-free for people who have knee pain. Oftentimes. It's a good substitute to keep you squatting. It's all about keeping you squatting while we figure out how to get you back to regular squat. Okay? Thank you. All right. This is the other part of it. Right? So technique does matter, but not all squats look the same, and I don't care if yours looks like the person next to you, just that the things that are important to me are the ones that are bolded, right? Weight balanced at the midfoot, which is, if you can picture your foot, right there. Right behind, like right in front of the heel bone. It's not the ball of the foot. And it's not the heel. If you can try to like go on a visualization here, your foot's like a tripod, okay? There's underneath your big toe. There's underneath your pinky toe, which is at the ball of the foot, not the actual toe. So it's here, and then the front side of the heel. If I maintain equal balance on all three of those points, I'm going to be in the midfoot, and my body will organize itself correctly. Okay? The second part, knees and hips release together. It's not, right? Rope at the hips, rope behind the knees, and I pulled them at the same time. Hips and knees release together. And then, what does it say? Squat straight down. No more hips back. Your hips are trying to go between your heel bones. Your heel bones aren't back here, right? Hips and knees break at the same time, straight down from there. I'm over the midfoot, I'm balanced. There. No more sit back. That's not a thing unless you're squatting to a box for a very distinct purpose. In squatting, it's knees and hips release together and then straight down. This is probably, the next two slides are the most important slides in my opinion. When to modify, okay? When to seek help sort of deals. This applies to the squat and just about everything else, okay? Most people wait too long. The check engine light comes on and you wait till it's smoking to come and see me and say, I want to get back to fitness. And I go, well, it's a journey now, right? So here are my general rules when people ask me, well, when should I modify? Or when should I like come and see you sort of deal, right? Because we're all resilient, nobody's fragile. Not every pain is a medical problem. In general, pain is not a medical problem, it's a PT problem. Pain greater than 3 out of 10 during activity. What is 3 out of 10? Everybody's pain scale is different, so I'm going to try to help you with this. A 3 out of 10 means I cannot be distracted from the pain. I can't think about anything else. 3 out of 10 means I'm changing the way I move. So instead of being able to squat straight down, I feel like I'm kind of coming off to the side to offload the painful side. Don't just keep doing that. You're training yourself into a problem, right? That's when you change your activity. You let your trainer know, you let your coach know, hey, I'm having these problems, okay? Now, some people don't know what a 3 out of 10 is until after. There's several in this room. What is an actual 3? For those of you that have interesting pain scales, if you believe your pain is less than a 3 during the activity, so you just keep going, that's fine. It is not a 3, less than a 3, if either of these happen. You are worse the next day. I am looking at you. Okay. Worse the next day. Worse range of motion after the activity. Okay? Right? Swelling is obvious. If you get I love that. People come in and they're like, well, it only got swollen a little bit. I'm like, what does that mean? Swelling's always a bad thing, right? Meaning you overdid it a little bit. Okay? And then when do you need to seek help? No change in your pain after 3 to 5 days. People love to wait 2 weeks, 4 weeks, 4 months, a year. The longer you have it, the more your body adapts to it, the harder it is to get rid of it. So when the check engine light comes on, meaning, well, that felt a little weird, or it's been feeling weird for a couple of days, or I can't squat as low, or I can't reach my arm up as high. If it's not changing by, optimizing rest and recovery after 3 to 5 days, it's probably not going to go away on its own. Okay? This is the most important slide in the slide deck. Everyone knows RICE, rest, ice, compression, elevation. That's what happens when you get injured, right? When you have pain. The dude who made that up, he literally made it up. He took it from amputation research. Now, I'm going to venture that having your arm amputated traumatically is far different than my back hurts a little bit, or my knee hurts a little bit. So he has actually written the foreword for the book that goes against rest, ice, compression, elevation. That's the antiquated model of injury management. This is the new model. Peace and love. I don't know why they had to make it so, but they did. They took the important things and they added the even more important things. So protection, yes. If something hurts, we don't want to keep, if you keep hitting your thumb with a hammer, it will keep hurting. So you need to modify if something gets injured, right? Pushing through is not always the best. Just because it's written doesn't mean that you need to do it, right? Listen to your body. They did take elevation, right? So swelling management, right? Your body gets swelling and fluid out by the muscles pumping. The muscles squeeze, the veins have one-way valves, and they go poof, and they open, and the fluid goes up, and then your muscle relaxes, and the valves close, and the fluid can't go back down. That's how it gets out. So when you have an impact on your muscle function and you can't pump the muscle as easily, we use things like elevation and compression, which is the next one after the most important one. The A is avoid NSAIDs, anti-inflammatories. Now, this always gets a lot of pushback, but I'm going to make a good argument for you. Your body is a lot smarter and evolved probably than you think, even though you might disagree. If you hurt something, the inflammatory process is there to break down what was irritated and rebuild something new. So if you go and you're like, I tweaked something, I'm just going to take 500 milligrams of ibuprofen. What you did is you just arrested the process that's supposed to heal the tissue. What happens with that is that there is no turnover then to healthy tissue. You keep yourself stuck in the middle of like, I'm broken down, but I'm not getting blood flow to heal that through there. So I'm not making a global statement, but what we do know is Tylenol is better than ibuprofen. Okay? It's not the NSAID, so it will help with some pain, but it won't stop the inflammatory process. So we really want to try to do that. The only negotiation I make with people is if you cannot sleep. Sleep is so important from a recovery standpoint that I will prioritize sleep and say that's fine if you need to take that to sleep, because it matters from an overall standpoint. Okay, and then education, that's my job. What do we do about it? Okay, that's the peace part. The next part is the love part. Crazy, what's at the top? Load. It's the only thing that makes the body better, right, is using it, okay? So loading within tolerance. Optimism. If you think you're going to get better, you will. If you don't think you're going to get better, you won't. Plain and simple. It does matter, actually, what you think. If you're like, I'm always going to have this, then okay, saddle up, you always will. Vascularization. This is probably my favorite one, because most people will say, my knee hurts, I can't do the workout, so I'm not going to go. Disagree. I can't use one part of my body doesn't mean that the rest of my body is like useless. Do you see those things against the wall? The bikes? They have the little pegs on them, so if one knee hurts, guess what? You can ride with 3 other limbs. When you can't pump one thing because it hurts, or you can't move because it hurts, the best thing you can do is get your heart rate up. Because we just talked about how important managing inflammation is. Your heart isn't going to be like, I'm not using my leg, so I'm not going to put blood flow down there. It doesn't care, okay? I kid you not, more often than not in the clinic, at least once or twice a week, someone comes in and they are flared up, and I do nothing but put them on the bike for 5 minutes, and then imagine, like magically they can touch their toes if their back was hurting. If you can get your whole system going from a blood flow standpoint, and you maintain that, and you maintain the things that you have through peace and love, load, vascularization, exercise, modified to your tolerance, things get better. Rest is the antithesis of getting yourself better. I'm not saying that relative rest is not helpful. Complete rest is not useful. I hear it every week. Well, I went to the doctor and they said I should just stop doing this. Okay, well, don't squat anymore. Cool, how are they supposed to get to the toilet? How are you supposed to get on and off the floor? I don't know. Because they just told you to stop doing it. That's not helpful, right? If you give your body what it needs, right, you take care of the ecosystem, so you sleep, high quality sleep. I'm not going to preach more sleep. It's high quality sleep. High quality sleep, you hydrate your tissues, you feed your tissues, you manage your stress, and you take care of range of motion and load through as much as you can tolerate, pain-free, things tend to improve. If you shut down the whole system, it's a slippery slope for people. So I encourage you to stop using rest, ice, compression, elevation, and use peace and love, okay? Questions on any of that? I know it's a paradigm shift. No more NSAIDs. Damn it. All right, any questions about anything I presented? No, you're all crystal clear. Right, you're like crystal clear. All right, so when it comes to the knee, right, your whole ecosystem matters. Your extension, very important. So important. I cannot impress upon you how important having full knee extension with quad activation is. Full knee bend, second important, as much as replacements allow. The replacement is not necessarily, I've seen a couple of knee replacements get like that full range of motion, but it's not common, right? But you do want to maintain it. So I find that for those of you who've had knee surgery or knee replacements in here, we get the range of motion in clinic and then we're like, good, we don't need to do it. Cool, you got it once, we're done. Please. Tissue healing far outlasts pain levels. So pain goes down and tissue healing is still happening 6 months, 12 months, 18 months. Okay? So just because you got 0 one time doesn't mean you get to stop doing it. I would encourage you, if you really have a history with knees, that the range of motion stuff that we went over, you're doing multiple times a week, basically for the rest of your life. I wouldn't, I mean, I prescribe it daily, but I don't know that it's sustainable for people. So I look at it and I go, what am I going to get a human to do? If you could do it daily and you've had a knee injury, yeah, you should do it daily. If you're like that person and you can commit to it, totally. It's taking it to end range every day, squishing it around, getting nutrients in through there that haven't probably been there for a while in those sorts of positions, and keeping it healthy. Yeah, it's like Gatorade for the joint. Yeah, I would do it daily, but at minimum, I would say, I look at that and I go, I don't know what kind of time people have to dedicate, so at least we're doing those multiple times a week and having touch points, right? The body heals much slower fully than we give it credit for. It's like, you know, an ankle sprain may get better, but ligaments and tendons take 18 months before they stop like lighting up on imaging of having some healing process going on. So it's a long time. And that's just kind of hitting general tissue health. So maintaining the low-hanging fruit, the foundational piece, is really important. I think we miss that. PTs don't do a good job of that. They're like, well, you're on the squatting, or we're doing sit stands, and you're good to go. And I'm like, nope. You need to keep your tissue healthy, and that takes a tissue approach. So having that like gapping where we're putting the towel and like really cranking that knee to end range, right? Or extending it out to end range. That's super important for a longer period of time than we really realize. Especially if you want to hike and do all that kind of stuff. Totally. Okay. Got it. Cool. Snap, crackle, and pop. If you make noise and there's no pain associated with it, I don't usually care. Snap, crackle, and pop is typically not necessarily, it's not bones realigning. Usually there's pressure within the capsule of a joint, and you're moving from liquid to gas state by way of negative pressure. So it can tell you that there's an imbalance somewhere, and you need to figure out what the imbalance is. but it's not necessarily indicative of anything gonna be like progressing to pain. I can't draw that line, I haven't seen it enough, but I do know that it means there's an imbalance. And so it's a matter of figuring out what that imbalance is. Yeah, I mean, I snap, crackle, and pop in the morning when I sit all the way back. Joint hasn't been in that position for a long period of time, so you're getting a little negative pressure through there, which is really all popping is. So, any other general questions? I love that, that's a good question. People love that. I make noise. I go, does it hurt? I don't, okay. Anything else? Yeah?
What is, so sometimes like my knee will just like flop, and then I have to push really, really hard to get it so that I can actually use it.
That's called come and see a physical therapist that wants to look at that. Those things aren't normal. That is, I would never say that that's normal or that I would expect to be living with that, right? That is, there is something going on there, for sure, so.
Yeah, it's the same thing that has a torn meniscus.
Okay, I'm gonna answer that question about meniscus. So, a couple of things about meniscus. I'm gonna give you some background on it and then I'll give you just kind of my professional opinion. Outside of things, you wanna keep as much of your meniscus as you can. Cutting out your meniscus deepens the joint stability, but it also is the cushion. So when they go in and they're like, oh, we'll just go in and cut it out, it doesn't grow back. So you fast track yourself to a knee replacement doing those sorts of things. Particularly if it's degenerative, meaning I didn't twist or fall and it's not acutely swollen, it just has started to become painful. Usually there's a dysfunction in movement or an imbalance across the body where we're getting too much load on it and it's become sensitive. Okay? Anecdotally, in the last 2 years, I have seen 4 individuals over the age of 55 who had meniscectomies and they did not do very well. They went in and they're like, we'll just simply cut it out. Okay? Their pain did not get better. Okay? And it has been a very long process to get them back operating, like into squatting, because of that increased pressure on the joint. Okay, so I would not say that locking is normal. It can be managed, right? That being said, I wouldn't immediately, I'm glad that they don't want to replace, they don't want to cut it out. Thank God. Yeah, they don't want to cut it out. Meniscectomy, like, we should not be seeing as many of those as we do. In my opinion, research-wise, there's no difference, short-term or long-term, between the meniscectomy and true conservative management, which is, conservative management in my book is not rest it for 6 weeks and do nothing and see how much better it doesn't get, right? It's what are we doing to work on range of motion? What are we doing to manage swelling? How are we modifying activity so that we can actually help that ecosystem heal a little bit? Yeah, so it's a great question. Meniscus is pretty popular, so. Any other questions about knee health? Yeah. Bone on bone? What about it?
The cartilage will never grow back. I have pain, swelling.
Joint health. As much as we can do to manage joint health, no, the cartilage will not grow back. And I would say that the PRP and the stem cell stuff hasn't gone on long enough for me to like recommend it either way. It's still so new that I don't think I couldn't recommend it. It's like they may say that they're seeing that, but I don't know what they haven't figured out is how much do you have to have for it to work? What is the protocol for after? Like, what are real expectations for that? Bone on bone, though, I go back to the idea that when we talk about the knee, the people who do the best manage their whole ecosystem, okay? So it is meeting exercise guidelines, right? Managing stress, clean diet, hydration, and then starting to do some of these actual tissue health pieces and modifying appropriately. So rather than not squatting, it's like, what kind of squatting can I tolerate? And going with that, because it's loading that joint and maintaining it, and you will see improvement. I've had 3 people in the last year who could not squat to an 18-inch box, and they're like, well, it kind of hurts when I do it. I go, okay, well, we're still gonna do it 2 days a week. They come back in 6 weeks and they're like, my knees feel way better, just by kind of using it, right? So if you're not changing the way you move, right, and it's not worse the next day, you are not harming yourself by having a little bit of pain with exercise. In fact, you'll probably find that if you stay with that, things will get better, as long as you optimize the whole environment.
And swelling.
Got to manage swelling. Totally. Swelling is the big sign, right? Swelling is, I'm probably overdoing something. So you've got to figure that part out. So, yes.
Thank you.
You're welcome. Yeah.
Arthritis.
That's bone on bone.
Okay, that's bone.
Yeah. Yep. Totally.
So, same thing.
Same thing. Same thing. Optimizing movement. You know, maybe you're not somebody who can squat, 2-3 days a week, but you can squat 1 day a week, and you can work on the other patterns. But yeah, we start looking at the whole ecosystem. If you're missing range of motion, start there. If it's painful range of motion, start there. Period. Right? And then listen to coaching in here, or communicate with coaching. Modify so that you can do those movements and you're seeing progression and you can work your way through that.